on that. I had earlier on talked about the non-communicable diseases. That will also be one of the key areas that we want to front. Also, the issues of domestic resource mobilization to ensure that countries allocate budgets for health. Yeah, thank you.
Okay, and Mr. Mungira, from the new emerging agendas that will be introduced, what do we expect? How are you going to handle these agendas? Any resolutions that will be put to these?
Yes. This meeting is organized around a theme, which is advancing health systems for emergency response, equity, resilience, and sustainability in the context of achieving the universal health coverage. And alongside this theme, we have sub-themes looking at how, for instance, Africans are prepared to having health systems that respond to these emergencies. We have a theme that looks at the funding for health amidst the financial space that is continuously getting squeezed. We are looking at the issues of emergencies, like Udoni has mentioned. I can add on the list, include things like the alcohol use, alcohol abuse and substance use, issues of malaria, issues of TB prevalence. I'm also looking at how resilient African systems can be strengthened by looking at the local pharmaceutical production. But to wind it up, we are looking at countries developing commitments that respond to this theme, which have to be implemented in the course of the year. But also looking at having an agenda, winding up the agenda with developing, adopting a Lusaka call to action, which will be a far-reaching blueprint that explains the policy, funding, and programmatic actions that respond to strengthening the health systems in Africa.
Okay, and how important is this collaboration? I know apart from the parliamentarians, we do have the ministries of health, we also have other stakeholders. How is this collaboration important?
The collaboration is important because the different stakeholders have different roles to play. You know, for a parliamentarian, the best a parliamentarian can do is to go to the podium and announce a commitment, but it's not a parliamentarian that will necessarily go out and implement. So in order to facilitate implementation, you need to have a mix of other stakeholders, including like people from the ministries of health, to making sure there's a strategic and policy coherence. You have to have development partners who can facilitate the process of implementation, bringing in resources, providing evidence. We have also stakeholders like the media, who should come in handy to making sure that they provide visibility for these issues that will be discussed. So the appreciation of the different roles that the different stakeholders play, the reason that we have a mix of different audiences attending this kind of meeting.
Okay, Ms. Kansime, I'll throw this question also to you. How important this collaboration is, especially amongst the participating delegates?
Thank you so much. Like we mentioned, we have invited different stakeholders to mention, for example, the civil society organizations. These are very key for advocacy when we go back to our respective countries, to bring on board the group that is not here with us, to make sure that the commitments that we're developing implemented when we go back, but then also having ministries. We hope that the commitments that will be developed will be aligned into the Ministry of Health, strategies and policies. So we're looking at aligning the issues that speak to national priorities. Yeah, and also partners like the academia who provide data and they conduct research. So we're hoping that they'll be very helpful to provide information and provide data to the parliamentarians as they set commitments for this year.
Okay, knowing that you've had previous forums before, how do you measure the commitments that are made during the forum?
Thank you so much for that. I think generally we have been progressing very well. We use a tracking tool to track commitments where we engage the clerks of the different parliamentarians to ensure that they track the progress of the implementation of the commitments. And I must say, if we are to rate ourselves, we should be like at 80%. Of course, we realize that there are challenges and some countries are not able to implement those commitments as planned, but we have, I think, some good response on the implementation of the commitments.
Okay, Mr. Mungira, how would you rate the level of the commitments from the participating countries? And I know she's mentioned there's some countries that have challenges. How does now the forum help the countries that have been having challenges to implement the commitments that are made during the forum?
Right. I must say that the commitments that are adopted, they do not duplicate, and they are not in conflict with the already existing national planning frameworks around the subject matter. So what happens is then to making sure that the planning processes takes care of these commitments, because they are the same. They are not in a conflict in any way. The role of parliamentarians then is to making sure that it is intentional for people who are in the planning, making sure that these commitments are integrated within the already existing national frameworks of the countries. Now, in terms of implementation, we are, of course, cognizant of the fact that parliamentarians do not implement, and also their offices are elective. Parliamentarians can be here today, but the next round of elections, the parliamentarian will not be in parliament. So we intentionally making sure that we enlist the support of the parliamentary clerks who are permanent employees based in parliament, making sure they do the coordination around making sure these commitments are implemented. Tomorrow you will note that, as I've already mentioned, in attendance we don't have just parliamentarians. We have civil society organizations, we have implementing partners, we have development partners, and the reason for this is to making sure that they facilitate efforts around making sure these commitments are implemented. And like Doreen has already mentioned, one of the facilitating innovation that we have thought of to facilitate the issue of implementation, to having a framework for monitoring, tracking, reporting, and learning in terms of implementation. And I think it can help to go along the way to making sure that we get there, making sure they're implemented.
Okay, Ms. Kansime, as we head to tomorrow's opening, the clock is ticking. Yes. What message would you like to share to the delegates and, of course, citizens across Africa?
Yes, I must say that we're excited and we're looking forward to tomorrow. I think my message to all people out there following us on social media and those that will be in attendance, we are looking out for exciting, commitments that will be developed by the different parliamentarians that can be translated into laws and budgets. And of course, like my colleague already mentioned, to make sure that the commitments really contribute to the achieving the universal health coverage. We're also looking at prioritizing, equity and inclusiveness to make sure that no one is left behind. How are we catering for the marginalized communities and the vulnerable communities? So we're excited and looking forward to those actionable commitments that will be developing starting tomorrow.
Okay, and Mr. Mungira, your message to the delegates and to the citizens across Africa that will be following the forum and actually watching this 17th NEAPACOH Forum update. What is your message to the people out there?
Thank you. My message is, first of all, to recognize that the African health systems are still fragile. The disease burden is still high. The financing for health is very much constrained. The supply chains are fragile. The workforce are not readily available to making sure that they tie up all the endiness to make sure the equation balances. But amidst all, we have an opportunity of having a forum like we're having tomorrow, whereby some innovations that have worked, some practices, good practices that have worked, can be showcased. We have an opportunity where we shall have subject matter experts coming on board and providing latest evidence that can facilitate decision making. At the end of it all, we look towards having a commitment based on the evidence presented, based on the interrogation that have been done, based on the presentations, to having commitments that are far-reaching and implementable, to making sure that you have an advance, especially in terms of health system strengthening.
Okay, and briefly, so what legacy would you expect the 17th NEAPACOH Forum to reflect?
Thank you. We look forward to having a high-level participatory convening, flavored by high-quality presentations coming from subject matter experts, culminating into commitments that are implementable, high-quality commitments, which would create appetite for different stakeholders to wanting to associate with them in terms of implementation, and also looking forward to having a Lusaka call to action developed and adopted, which would be a far-reaching blueprint that should guide policy, program, funding actions to advancing health system strengthening in accordance with the theme for tomorrow's meeting.
Okay, and Ms. Kansime, what legacy would you like to see the 17th NEAPACOH Forum just reflect?
Yes, thank you. Of course, we are looking forward to having parliamentarians as champions of health to make sure that when we go back to our respective countries, these are the champions that will speak on the issues that really matter. And also talking about the network, that is the network of African parliamentary committees on health. We don't want to leave the place, with just a network, but we're looking at a stronger network beyond the forum that we are having tomorrow. Yeah, thank you.
I must say thank you very much for making an appearance on the 17th NEAPACOH Forum update. We can only wish you the best, even as we wait for the forum to be officially open tomorrow. I know the clock is ticking, so we can only wish you the best and the best stay in Zambia. And to our viewers and listeners on Parliament Radio and Television, of course, our Facebook and YouTube platform, this has been the NEAPACOH Forum Update Program. And my guests were Mr. Patrick Mungira, the Acting Director, that's Regional Director, and we also had Ms. Doreen Kansime, Policy Engagement and Communications Officer, both from the NEAPACOH Secretariat, that's Uganda, and we also had Mr. Kelezo Lushanko, who is the Zambia Focal Point Officer from the Zambian Secretariat. From me, Taz Piri, and the entire production crew, we urge you to continue watching Parliament Television. Remember, the forum will officially open tomorrow, and as Parliament Television and Radio, we will carry that live. So we do urge you to follow the forum live as it will be officially opened tomorrow. Keep watching Parliament Television and have a good day.
What is cholera?
Cholera is a diarrheal disease. A person with cholera will have severe diarrhea and vomiting. The stool will be watery, like rice water. The patient will become dehydrated due to loss of body fluids. The patient may die within 12 hours if he or she does not get proper medical treatment.
How can one get cholera?
Drinking untreated or contaminated water, eating foods with